I'm Freeman Dando, and I have epilepsy.
Baby Freeman. Crazy name for a crazy little boy.
Freeman was our second child born. Freeman was born September 23rd of 2005.
The day that Freeman was born was crazy. We already had our little daughter Hannah, and so we were really excited to have another child, but we didn't know if it was going to be a boy or girl. It was a surprise.
I still can't get over that we have a boy.
I was home. He was the perfect weight, perfect length, healthy. Freeman as an infant, to be honest with you, was a very difficult experience. The first 6 months of his life, he cried a lot. Just was really hard to put to sleep, and he often got sick.
You know, like every typical baby boy, he just would like to run around with a little bat in his hand. He played with toys and with trucks and cars. He was just a great little kid. Happy birthday, dear Freeman. Happy birthday to you.
And I remember he was 2 years old and 9 months, and we were actually packing our life to move from California to Arizona. The day before, I remember thinking he wasn't acting quite right, and I told my husband that night that I thought there might be something wrong. And
we got up the next morning and we packed the car, and I was out, doing the best job I could to get everything crammed into our little van. And Leanna mentioned to me, she said, he's doing it again.
He was raising his arm in a funny motion, and he was drooling and couldn't speak to us.
Freeman was standing behind me with a blank stare on his face.
We weren't sure what it was, but we knew it wasn't normal, and we immediately rushed him to the doctor.
I'll never forget it. It was probably the worst day of my life.
At that moment, we thought our healthy, perfect child of almost 3 years old, who has met every milestone as a toddler that you worry about. First time they've crawled, they've walked, fed themselves. We realized at that moment that he had a serious problem. And at that point, our lives changed forever. It wasn't long before we realized our son had refractory epilepsy. We thought initially that because he was so sick all the time and he would spike high fevers very quickly, we thought maybe by having so many high fevers that might have triggered having seizures. We quickly realized that wasn't it. After having several MRIs and neurological tests, there was no indicator that there was a cause per se, no tumor, nothing out of the ordinary.
Up until, he started having those absent seizures, we knew nothing was different about him.
So epilepsy is a disease of the brain, and your brain works with electricity. All of the cells of the brain talk to each other with electricity. And epilepsy occurs when there is extra activity going on and it's not well contained. So the electrical activity will kind of grow out of control and cause a discharge that can spread through the brain. And sometimes it will stay in one spot, sometimes it will actually spread and involve the whole brain. But that spontaneous activity that's growing on itself will sometimes cause a change in behavior. And that might be stopping your behavior, or it might be doing something involuntarily. It might cause you not to remember what was happening. So there's lots of different kinds of epilepsy and different kinds of seizures, but that's how it happens. So having just a single seizure, or having a seizure because something happened to you right then and there, like a head injury or something like that, that's just a seizure, which is different from having epilepsy. Epilepsy happens when you have more than one seizure occurring without a specific reason for that seizure to occur. So it means having repeated seizures over time. So the causes of epilepsy, there are just so many different causes. It can be something that you acquire because of an illness or an injury. It can be something that you inherit because of a genetic reason. And a lot of times we don't actually know what might be causing it. Sometimes we can do certain tests that will show an abnormality on the brain, or tests that look for a particular gene mutation and we understand the cause. But in a fair number of cases, we can't see an abnormality. We can't necessarily find an abnormality on the test results. But we know that there's some kind of a process going on that makes the seizures continue to occur. But generally speaking, you have to have two separate events, and those two events might be close together within a couple days of each other, might be far apart, might be more than a year apart, and that technically is still called epilepsy.
His diagnosis, no parent ever wants to hear that their son has a disorder that he's going to be dealing with for the rest of his life. So it was tough. It changed our whole family dynamic immediately.
I would guess that Freeman's probably been hospitalized 12 times. I think I said 8 times extended. He's probably been in at least 12.
The first test that everyone who has a seizure will have is an EEG, electroencephalogram, which is looking at the electrical brain waves inside the head. We put electrodes all over the scalp and just record the electrical activity. It's amplified very, very thousands of times so that we can actually detect it, because it's very, very minute electrical activity. If we put someone on treatment after we've done their first EEG and they're still having seizures, then we'll go back to the EEG again, but we'll do a much, much longer test. And we'll run it for several days in a row sometimes with a video recording the patient's behaviors, and we're actually waiting for a seizure to happen. And that's really the very best way to understand a seizure, is to actually catch it in the act. And that can help you understand whether you've made the best choice for treatment. Would a different medication be more effective if we discover it's a different type of seizure?
Freeman is on a very long list of medications. He currently takes Vimpat. He takes carbamazepine, 2 forms of that. He takes a fast tablet and an extended release. And he also takes, which we've recently added to his medication schedule, CBD oil, which became legal here for kids like Freeman and adults like Freeman with refractory epilepsy. He's been on CBD oil. His seizures are full grand mal seizures, where he will, have trouble breathing, and he will start to shake, and if he's not sitting, he will fall, and odds are hit his head. It's a very scary, shaky, full body situation.
So epilepsy can have some serious consequences, and in some cases it can be fatal. Sometimes fatal injuries can occur as a result of the seizures themselves. So certain activities are very, very dangerous if you have epilepsy, especially if your seizures aren't fully controlled. What I worry about the most is water, and I always warn patients about swimming or even bathing by themselves, because if a seizure occurs when you're in water and you go under the water, you might not be able to get yourself out of the water. So that's a very dangerous thing. But the most serious thing that we worry about that we don't have a lot of control over is what we call sudden death in an epilepsy patient. And the abbreviation for that is SUDEP, sudden unexplained death in an epilepsy patient. It's actually a very, very rare phenomenon, but there are certain risk factors that we know about that we can identify who is at risk for SUDEP. SUDEP is most likely to occur in adults. It's very rare in children. It can happen in children, but in most cases it's in adults. And it happens mostly with patients who have very active epilepsy, lots of seizures that can go into full generalized convulsive activity, and especially if that happens at night. So those are the risk factors for epilepsy, and those are the things that really motivate us to find the best treatments to try and avoid that kind of a consequence.
I remember specifically when we lived in Arizona and Freeman was 4, maybe 5. We were at Phoenix Children's Hospital, and we had just gotten a new doctor. And we were really writing all of our facts down and trying to make sure we had taken every test and tried every medication, and we were really just exploring all of our options. And at one point, his doctor said that Freeman has a 1 in 500 chance of having a seizure in his sleep and never recovering from that. And that was tough as a parent to hear that.
When he was in first grade, he would go to class and he started having seizures in school, and it just broke our heart. He'd have them in the middle of the class. I remember when I was in first grade, all I knew was Ramona Quimby and popcorn, salad or popcorn fests, Mrs. Dillon's class. My son doesn't have those memories. My son has memories of being rushed out of a classroom, being sent to the nurse so that they can give him rescue medication. And then just this year, 10 years later, he again started having a breakthrough. And what I mean by that is he'd been stable, and stable is a relative word. He was only having 4 seizures a week at night when he's sleeping. And about end of March, he started having some during the day. Then he had them during class. And then he was having up to 17 seizures. And I had to take work off. We pulled him out of school, and we could not control them with any medication. That was scary. And he was having 1 every hour at least. In the day, in public, he was out of control. And that was extremely scary because our lifelines were all failing us.
Emotionally, we still are impacted. As a parent, you only want the best for your child, and seeing and knowing the struggles that he has had and will continue to have is very heartbreaking. You just want the best for your children, and knowing that he has to work and fight a little bit harder every day through seizures and medication, it tears a parent apart. Every time Freeman was admitted into the hospital, it was a major impact on our entire family. Most of the time, our older daughter would be in school or sleeping when we had to rush him to the hospital, and so she would often wake up with a grandparent flying in or a neighbor helping us out until we could get home to explain to her that her brother's been in the hospital again. It was very tough on her.
Hannah had to deal with not knowing what was going on. We didn't know what was going on, but as a young kid, seeing your sibling being rushed away from you, and you're just, at that young age trying to figure out what's going on, I can't imagine how it can't affect a child. Julia had never seen Freeman have a seizure. She was born in Phoenix and he was under control, and then we moved to Texas and he hadn't had any real issues since she'd been old enough to remember. And then this year when I mentioned he'd had so many seizures, 17 a day, it scared Julia to death because she had never seen that. And so I thought back to when you were her age, seeing it. It can't be a good thing for little kids to see their brother, who they love, having uncontrollable, body movements and choking. It sounds like he can't breathe. It's scary. You have several things in your life that affect you, but having a child get a disease or being diagnosed with a disease that there's no understanding or no cure for, it breaks your heart.
It's very hard. It's very hard for him as a kid to sit in a bed and not understand fully at a young age why he's there. It's hard as a parent to explain to him that it's going to be okay when maybe it's not going to be okay.
Being in a hospital is like a one in a forever experience, because it's very scary. You get IVs, you get your brain hooked up to stuff, and it just scares you because you go through the whole entire experience of getting on that in on your body. So it's uncomfortable and scary at the same time. The hardest thing about having epilepsy for me is probably the fact that I know I have it, and that most of the time I'm aware during a seizure, which it's terrible. It makes me very scared on the inside and outside, but I can't move. I can't change anything that's going on, and it's just like you can't do anything to help yourself. So it's very scary.
What does a seizure feel like from your perspective?
To me, it feels like kind of if you were a robot and your body is just shutting down. It feels like your heart stops beating, and it feels like you can't help yourself whatsoever. You can't feel your body. You can't feel anything really. You're almost unaware of everything that's going on.
There are so many symptoms of a seizure. It can be really difficult to give people an idea of what to look for. So that's something that I talk about a lot with my families, to try and help them be prepared for how to recognize a seizure. The problem is that just about any kind of behavior that you can imagine can be a seizure. And if you think about it, that kind of makes sense because a seizure happens in your brain. So depending on where the seizure is occurring, that's what causes the behavior to happen. So sometimes what happens during a seizure is just something that the patient experiences and no one else can see it. So it can make you hear things or feel things or see flashing lights or smell things. Those kinds of sensations can be seizures. Other times it can just cause confusion. It can cause emotions. It can cause fear. It can cause anxiety. It can cause people to laugh or cry. Lots of different kinds of things. It can make people say things they don't mean. And it can even sometimes cause very complicated behaviors, like running seizures. But probably the most recognizable kind of seizure is what I call the Hollywood seizure, which starts with stiffening and then shaking. It will spread to the whole body, usually makes the patient fall down. Sometimes they'll lose control of their bowel or bladder. I call that the Hollywood seizure because that's usually what you would see in the movies when somebody has a seizure. Epilepsy can be inherited. It's probably the case that half of all epilepsy is inherited. We don't really know how much is. We think that a lot of the cases where we can't find a cause, it's due to genetic causes. Sometimes it can be new in a family even though it is genetic. So there's a little bit of a difference between genetic and inherited. You might not have any family members who have had epilepsy before. It might be new in a child, in a baby, or in an adolescent, and they didn't even know that they were at risk for that because it took a combination of genes from each parent together. So that's genetic, not necessarily inherited. So there's a couple of different peaks in the lifespan where epilepsy is likely to occur. The very most likely time that you would have epilepsy develop is when you're very, very young. So in early infancy, especially at birth, but even in the first few months of life, that's the most common time that epilepsy will develop. And a lot of those kinds of epilepsy are very, very severe and can cause a lot of other neurologic problems, but some of them are actually very mild. And they are genetic and they run in families, and those babies will outgrow epilepsy sometimes. The second peak in the lifespan is in adolescence, so in high school. And the reason that it happens a lot in high school is because there are certain genetic forms of epilepsy, again, that are especially prone to come out in high school. We don't really know why that happens, but it probably happens because the brain is changing a lot. So different kinds of chemicals and different kinds of receptors are changing out as the brain is maturing, and it will bring out that tendency for seizures.
What do I want people to maybe gain from this video and learn about epilepsy? I think the most important thing is that it can affect anyone. I want people to realize that they can be impacted by this. It might not be today, it might not be next year, but there will be a time where they will have someone close to them or someone close to a friend that is severely impacted by epilepsy.
If I could say one thing to people about epilepsy, it's that it's more common than I think most of the general population realizes. And I'd like for the world to understand and educate themselves on epilepsy and how to help somebody if they see someone having a seizure next to them, and that it's not a scary thing. They can quickly help and become educated on what to do and what not to do if they see somebody or if they have a loved one that has a seizure.
Do you believe that there's a cure somewhere for epilepsy?
I do, because if we can find the cure to diseases, and we do, I think, have the good amount of technology to create a cure.
Do I think that there's a cure out there for epilepsy? I think there's a cure out there for everything. I truly do. See you later, dudes.